I'm Dr. Carl Clark. I'm the President and CEO of the Mental Health Center of Denver. At the Mental Health Center of Denver, we help people recover their lives. Anyone that's dealing with any type of mental health illness. We see all ages, from young children to the elderly, and we see a lot of people. We are located in Denver, and we have both our own facilities and we embed ourselves in other people's facilities. So if there's a place where people are already going and they need help with mental health illnesses, we get our staff in there and embed ourselves where people are already going. So we're like in school-based health clinics, we go to nursing homes, other non-for-profit groups, and that model of going where people already are really works out. When people come to visit us, they do notice what we call our wellness culture. And what that is we try to create an environment where people can do what they do best every day. In fact, every employee that comes to us does a Strengths Finder evaluation to find out what they're naturally good at. What are the top 5 things that they're good at? And we work to create an environment where they can use what they're good at every day. So, some companies look at, what are you not good at, and let's work on that. And I always tell people, like, if you want me to sing opera, it is never going to happen. And no matter how much you work on that, it's not going to work. But if you take what people are already good at, you can take them to greatness. And that's why people love working for us. Other people ask me, what might make my company successful? People want to feel like they're doing something that's meaningful. They want to do something that's bigger than themselves. And people want more than just the work that they're doing. They want to feel like they're contributing to something big. And the better that a company can describe what that big thing is, how they're making a difference in the community, how they're improving the lives of other people, or making our community better, that's what people connect with. And sometimes people love hearing that from the leadership of a company, of like, this is how what you're doing is making a difference where we live. One of the things that sets us apart from other people in our industry is that we actually measure people's recovery. We measure their success. So we have a whole set of instruments that we use that look at the viewpoint of the person themselves, about how they're doing in their treatment, and also from the viewpoint of the clinician. And people like knowing when they're better. And just like if you were to go see a doctor and say, how am I doing with my diabetes? The doctor's going to tell you something more than you're doing well. They're going to say, oh, your hemoglobin A1C is excellent. It's just like somebody who doesn't have diabetes. And when people are dealing with mental health issues, sometimes there's a lot of input from all kinds of folks about how they're doing and their viewpoints and that sort of thing. And to get really good feedback about progress that people are making, people love that. And that's what sets us apart. Well, one of the big issues that we have is that 1 in 5 people are dealing with a mental health issue at any given moment. We know people can and do recover. Our issue is capacity. How do we grow our capacity to meet the need in the community? Because frankly, there are more people that knock on our door than we have room for. So we ask the community to help us with a growth campaign. We set a goal of raising $8 million to help expand our services. And I am very happy to say that the community was absolutely terrific around this. They not only stepped up to the plate, we just closed the campaign at $8.5 million, which translates into more kids, more families, more people getting back to work, back to school, and all those things, which just really makes all the difference.